When somebody is interested in plastic surgery and they decide to start looking for a plastic surgeon, I think it's important to ask friends, see if they've had any experience with a plastic surgeon. Another important area where you can gain information is to ask your primary care doctor or your gynecologist. Both of those doctors are going to have some experience in their community and are going to be a terrific resource in advising a patient on who she should seek for plastic surgery. It's critical that when a patient is looking for a plastic surgeon, they ensure that the plastic surgeon is board certified, but not board certified by any board. The surgeon should be board certified by the American Board of Plastic Surgery. It is the only recognized board for plastic surgeons. One of the advances, I think, in plastic surgery and most board-certified specialties is that it's not a one-and-done situation. You may pass your boards, but you have to take your board examination again every 10 years. They want to ensure that your qualifications remain at the highest level. And so every 10 years, you will submit your cases. They will then design the examination, the written examination, based on how a plastic surgeon's specialty has evolved to ensure that they're still competent, safe, and doing a good job. It is a boutique practice. It offers a comfortable, secure, confidential location for plastic surgery, both for consultations and for surgery. In my practice, I have a fully accredited surgical suite. My operating room follows all of the same requirements for equipment and drugs and safety devices that the hospitals have to follow or the outpatient centers follow. As a matter of fact, if you walk in my operating room, it doesn't look any different than the operating rooms at any other place, any hospital you walk into. I run a very patient-centric office. The patient is always number one in my employee's mind and in my mind. Patients often ask me before I operate them, they'll say, now you are going to be the surgeon who's going to operate on me, right? And I'll say, well, what do you mean? So, well, it's not going to be an intern or a resident. I said, no, it's just me. And in follow-up, it's just me. There's not going to be somebody else who's going to follow you. I will see you from the initial consultation, through the surgery, through the post-op, and if there are problems, I will follow you until whatever problem resolves. I have an assistant who's been with me for many years. She sees you with me, and every once in a while, I will be in the operating room and you may see my assistant, but you will know that assistant because she's been here for many years. She's also been the one who saw you from the initial consult to the preoperative evaluation to post-op. So you will feel very comfortable whoever you see, but I can tell you that it is almost always me. My practice is focused on aesthetic surgery, essentially face, breast, and body. So in the face, the procedures that I do are eyelid rejuvenation, facelift, neck lift. We have a skincare department that if you have skin problems, we have a skincare expert in the office who can evaluate you and treat you for any skincare issues, acne or brown spots or fine wrinkles. In terms of other surgeries that I perform, breast surgeries such as breast lift, breast augmentation, and breast reduction are the primary breast surgeries that I perform. And in terms of body contouring, it's tummy tuck and liposuction. Once a month, my practice offers a free seminar. The topic changes every month. It can be facelift one month, cool sculpting another month, tummy tuck another month. But it's an educational seminar that starts at 6 o'clock, ends at 7 o'clock on the dot. It's 30 minutes of me talking and 30 minutes of questions, and you can ask any question you want to. During the seminar, I will go over who's a good candidate, what's involved in the surgery, what kind of recovery you can expect, and then I open it up to the floor to ask any questions that the attendee may have. The website is the source of the date of the seminar, but it's an hour of your time, and if you're interested in whatever topic that's being given that month, and it's a great time to come and sit with us in a very informal way and learn about that procedure. I have a website, www.barberplasticsurgery.com. It's informative, educational. It lists the procedures that I do. It will provide a narrative describing each procedure in terms of what's involved with the surgery, what's involved with the recovery. It's a great resource to check out. I perceive my website as an educational site, something you can learn about me, you can learn about my staff, you can learn about what I do, my history, my education, and so barberplasticsurgery.com is a great resource. To make a consultation, simply phone our office at 336-275-3430, and we'd be happy to make an appointment to see you for whatever you're interested in.